Hold on. Wondering how a nebulizer is used? Watch this detailed video till the end. A nebulizer is used by patients with COPD and asthma to deliver medicine deep into the lungs, where it is most needed. Nebulizers are prescribed for people who have difficulty utilizing inhalers due to medical conditions or cost reasons. The liquid medication is turned into a mist using a nebulizer, which is then breathed through a mouthpiece or a mask. A nebulizer has a mouthpiece for the medicine cup, a top piece or cap to connect to a mask, and a thin plastic tube to connect the mouthpiece to a compressor. This is how you do it. You first attach the mouthpiece, then the top piece to the medication cup. Put the mask over your face and firmly seal it with your lips. Activate the compressor. To avoid spills and proper medicine distribution, hold the nebulizer upright. Make sure to take a few steady, normal breaths through your lips. Continue until the cup is empty of all the medication. And there you are done.